Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. I wanted to start with the clinical guidelines training that started yesterday for RHOs. And specifically, I wanted to ask, uh, why is it necessary to have standard treatment protocols across the board? Let's begin there.
Well, we had guidelines that existed last year. We set up a committee to look at how we are going to treat COVID and what are the drugs we'll be using and when you need to use them and so forth. So we had these guidelines that existed before, and what we're doing this year is updating the guidelines. Last year, when we concluded those guidelines, the first version, if you like, we were able to do some Zoom training, but we thought that it's important to have a more in-house training where people were able to come in. Of course, we are observing the COVID guidelines, but that we can work with people more on a one-on-one basis, because we want to, while we're standardizing these guidelines, we want to take into consideration the peculiarities of the region. And we thought that it's important to get the perspectives of the different regional doctors. So they have come in and they're going to help us to customize the guidelines, so to speak, to make it more operational in their regions. So yesterday it started. The treatment and so forth are standard, but there might be some peculiarities given some of the geographical spread and things like that that we have to take into consideration, how to move people to some of the sites if they require ventilation and things like that. So that's what we're working on right now.
All right, so you ended up answering two of my follow-up questions, but I wanted to ask also, how did it initially coming to arriving at the guidelines itself, what did the committee, some of the specifics of what the committee would have focused on?
So first of all, we know the duration of the disease from when you get exposed to the incubation period, then the clinical period, which would include if you get a mild or asymptomatic form, what are the signs and symptoms expected, what do you do then? If you go to a more moderate form, what are the signs and symptoms you look for during this period, and what actions you need to take? So do you need to hospitalize, not hospitalize? So those are considerations. So for every phase of the disease, the clinical phases of the disease, doctors and medical professionals then would use these guidelines to make certain decisions. And the best practice has been, once we start seeing people having respiratory distress, that it's important to have them in a hospital setting where we can monitor them and be able to give them respiratory support if it becomes necessary. So there are clear guidelines that we have developed to guide a health worker on what would be the next steps. Once they identify A, B, C, D things, then this is the next step. You admit this person, or you don't admit, depending on what you're finding. And then if that person is in the hospital and they're undergoing treatment, then by monitoring them, you know when to shift from using these sets of medication to another set of medication, depending on the patient's condition. So that's what the guideline is aimed to simplify, making the diagnosis, helping to diagnose what phase of the disease the person is in, what are the measures that you need to take in each of the phases, and once you take them, what are the things that you need to monitor, both laboratory-wise and other physical signs and so forth that you need to be guided by. And once you take those measures, what are the outcomes that you're expecting? And of course, there are complications that we have to look out for as well. So the guidelines are really meant to standardize care across Guyana and to assist the doctors in being able to provide, even level of care across the country. And by understanding these protocols, it makes it much easier. So the training would help to reinforce this, and the guidelines themselves, while we would have put together our best practices, we are also borrowing information from what is happening globally. So a lot of the information that we have in these guidelines are taken from the WHO, from PAHO, from other guidelines that have been done internationally, but adopted to suit our context. Because if you look at a guideline from the NIH, they would have some of the most cutting edge medicines, which we don't have in Guyana. So we have to utilize the range of medicines that we have locally, and these guidelines would reflect that.
All right. You mentioned a word just now that's now slipping me, but aside from the obvious, it is also keeping medical practitioners accountable to some extent, and that was one of the things that I got out of what you said just now.
Well, the thing is, it's important that healthcare workers are able to recognize the phases of the disease, because the disease has different stages that you can go through. And it's important that when you're treating someone in the hospital, it's important that you know when they're transitioning from one to the other. And therefore, if they move from one to the other, then you need to appropriately change the medication to suit the new stage that they're in. So these are things that are very important in managing the patient. And once you follow these protocols, you'll get better results.
A few things. I noted yesterday you mentioned the P1 variant. That was the one discovered in Brazil, and that one is also easily transmissible. And I also noted that you indicated that samples will be sent from those regions bordering Brazil as well. And I believe you said it will be more wider in terms of samples that would have been taken from persons who are now deceased.
So there are a couple of things that we wanted to know. And for example, because we know Brazil has the P1 variant, people who might be coming across from the border, we want to know whether or not there's any indication of the variant coming into Guyana. So we have to go closer to those areas to try to detect. And so samples coming out from those areas, we'll be sending them for sequencing. Another important question for us, because we do think we have cases of reinfections, and we wanted to know whether someone was infected with, let's say, a variant earlier in the pandemic, and now they got reinfected with a new variant. And if that is the case, what are the differences, and to better try to understand that. So we have some suspected samples where we think this might have occurred, but with the gene sequencing, we'll be able to get a better understanding. And severity, because if people are coming down with a more severe form of the virus, one way of checking that is the people who died from COVID. So we can go back and look at those samples and see whether or not they might have had the regular COVID, or maybe they might have had a different version. We don't know. So we want to investigate these things and to determine. And once we investigate them, doing the sequencing, we'll get a better understanding. Maybe there's nothing to it, or maybe there might be some changes. So that's what we want to find out.
Thank you, sir. I want to wrap up quickly. But before we go, I wanted you to talk about so we're getting some assistance from Japan, and I know that the ministry has released a list of testing sites for vaccines in some of the other regions that we could talk about.
So in terms of vaccination, we have teams that are in every region. Initially, they're working with the healthcare workers in those regions to immunize them. And we have expanded that now where we are going to be giving the vaccines for persons 60 years and above. We are going to publish shortly all the sites in the different regions so that people are aware where they can come for their vaccines. Similarly, for Region 4, I think we've been getting a lot of queries, so we'll publish that list shortly. It's going to be an extensive list, so it might be a challenge to repeat all the places here. But certainly we'll put out that notification so anyone 60 years and above will know exactly where they have to go to get their vaccines. In terms of the aid from the government and people of Japan, they had put out a call, so to speak, to different countries, and we have responded, and we have put up a list of things that would help us in our response to COVID, and our understanding is that they've agreed with the list, so we're expecting that those items will be coming into Guyana shortly.
Yeah, and those are PPEs and so on, right?
We focus more on some diagnostic equipment, which include things like x-rays and ultrasound and so forth, because we need these tools to be able to see what is going on in people's lungs and so forth. So one stage of the disease is that the changes in the lung, and therefore if we have good x-ray equipment, we'll be able to detect those very easily. So that's what we're hoping to do, and we'll use these equipment to put them in some of the regional hospitals.
Okay, sir. Well, thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.